No.
Like, okay. My name is Dr. Dilip J. Khanek. I'm a pediatric neurologist in Austin, and today I will be talking about management of ADHD. And in today's sense, we'll see how we manage by using different modalities. Now, attention deficit disorder or ADHD is quite common. It affects between 5 and 9% of children. So we see them in my clinic a whole lot, and I'm managing them for almost 40 years. So during this time, I'll tell you what I have seen works and how we can help children and parents so that the child will do well from academic point of view. Now, everything what I'm going to say today is for educational purpose, and nobody should take this advice and apply that for that child, because you got to make sure that your child is seen by an expert, either pediatrician or a psychiatrist or a child neurologist, and they will manage your child effectively. But this will give you an idea what's out there. So during this time, we'll see various medications and modalities. When it comes down to ADHD, I want to make sure that we use almost all modalities that are available for parents, and they include academic help. Child may have learning disability, reading disorder, writing disorder, mathematic disorders, or processing issues, and you got to treat those things by using teachers or therapists, and that way that child will do well. Medications and all that may not help that child as much as adding these modalities. The second thing that I see quite commonly is it's depression or anxiety, and that mask some ADHD symptoms, or they present as ADHD symptoms, and you got to make sure that you evaluate them appropriately and manage them. But when we see children with ADHD issue, I generally advise parents to make sure that they take regular diet, appropriate diet, which has more protein in it, and make sure that they don't have a whole lot of junk in it. I also add some nutrients to their diet, and these nutrients include appropriate levels of magnesium in their diet, zinc in their diet, omega-3 in their diet, some of the vitamins like B6, which is a catalyst, or methylated folic acid, which helps them to have a better personality if they have mood swings or anxieties. And again, make sure that you discuss that with your pediatrician or your expert who's managing your child. Now, some people will also use neurobiofeedback. There is some documentation that it does help children. And once you go through all that, eventually it comes down to therapy and medications. If they have significant behavior issue, you've got to get appropriate therapists to help them so that they can manage their everyday or day-to-day activity well. I'm going to concentrate a little bit more on medication because that is my expertise. And when it comes down to medication management, there are 3 different levels of modalities. One is stimulant modality, the second one is non-stimulant modality, and the third one is medication that can be used but they're not approved by FDA. And of course, for those decisions, your expert or pediatrician or physician will make those appropriate decisions. But my goal is to give you a little idea what is out there and what you may benefit from. We said stimulant, and there are 2 kinds of stimulants that are available. The first one is methylphenidate based medication, and the second one is amphetamine based medication. Now, some physicians may prefer amphetamine based medications, and the other prefer non-amphetamine based, like methylphenidate based medication. They vary a little differently, and therefore one may have a choice of one versus the other. I prefer most of the time methylphenidate medication because I think they are milder to some degree and the side effect therefore will be milder. However, again, your physician will make the best decision about your child. In methylphenidate, there are a couple of products that are available, and I want to show you what are available by using some of the pictures and photos I have of different pills. So we are going to go back into some plates I have, and that will explain to you what are the medications that are currently available in market. Now the first group of stimulant that we are going to talk about is methylphenidate derivatives. Now they all have the same ingredient, but the delivery system is different in those different products. Let's take an example. The old ones which were classic were Concerta, and Concerta would give medicine that would last for about 12 hours, and it comes in different denominations like 18 milligram, 27, 36, 54, and it can go up to 72. The other one was Focaline. Again, it's a very different product than Concerta. It's more purified one, and some physician may prefer that. Ritalin LA is another old one. Methylphenidate, which is called Metadate, is another old one. Now, though they all have the same ingredient, they work for different duration of length. For example, Focaline works for 12 hours, Concerta works for 12 hours, whereas Metadate and Ritalin LA, they work for 8 hours. Now, in last few years, there are many other medications that were approved and introduced. One of them is Contempla, and Contempla is ODT, which means orally disintegrating tablet. Now these tablets are little tablets, and they get dissolved in mouth. And the last one in methylphenidate group, you have patch, and that is called Daytrana patch. Now these patches are available in strengths of 10 milligram, 15, 20, and 30, and depends upon child's need, you can adjust the dose. But the best thing is that these patches are put on a gluteal area, and they last for as long as you put it on, or about 12 hours. And they go smoothly in. You put one patch in the morning and take that patch in the evening out, and that medicine is delivered as long as the patch is attached to the skin. So you can see that there are so many choices that we have at this point. One point is sometimes I have seen Concerta doesn't work, but Contempla work, or Concerta didn't work, but Focaline work, or all this medication did not work, but the child did very well on Daytrana. So really it's a skill of a physician who is managing your case, and they will adjust the dose and medication according to your child's need. So that is our first stimulant. So we have seen different medications, different approaches, the stimulant, methylphenidate, amphetamine-based stimulants. We have seen non-stimulants like atomoxetine or guanfacine. And sometimes these medications are useful, but they may be producing side effect or they're ineffective. In those situations, we can use unapproved medications, and of course your physician will make those decisions appropriately. But there are times when we have to use medication like anti-anxiety medications or antidepressant or Provigil, which has been approved for excessive daytime sleepy state. Now, 65% of children will respond to medication. About 5 or 10% will develop side effects. So briefly, let's see the side effects. The common ones are reduced appetite, not sleeping very well, mood swings, irritability, abdominal pain, headache, and monitoring is very much required. Sometimes they don't eat well, therefore they don't grow well, and so you have to get every child's height, weight monitor on graph. You have to get their heart rate, we have to get their blood pressure, and all this is very important in follow-up. Therefore, if your child is going to be on medicine, appropriate follow-up is very essential. If there is any problem with side effect, then of course you have to change one group to the other group. One thing I want to tell you before I go, today there are so many options, and most of the children will do well on some modalities or the other. It's my experience that when you combine different modalities, your efficacy is much better. So advice is, go to a physician who has a lot of experience managing ADHD, and your success rate is right there. Thank you very much for watching. If you need more information, go on our website pedineuro.com or drkanik.com. Thank you.